Hello everyone, I'm Hongfu Liu. I'm assistant professor from Brandeis University. Today I'm going to introduce our highlighted project, Effective Data Curation for Accurately and Fairly Predicting Readmission for Older Adults. This project is joined with Feifan Liu, Ben Gamber from UMass Chan Medical School. Hospital readmission within 30 days of discharge present a significant public health issue, particularly true among older adults. There are several reasons, for example, the medical conditions, the polypharmacy, inadequate post-discharge care. So this readmission impact healthy aging and increase the healthcare cost, with unplanned preventable readmission costing billions annually. So help, yes, but it still encounters several challenges. So even AI is so promising in prediction readmissions, but the current research in this area remains in its infancy, and many challenges remains, including model generalizability, interpretability, and clinical integration. So in this project, we focus two specific challenges. The first one is from the data perspective. The existing AI solutions mainly focus on the algorithm design and neglect the importance of data. We all know garbage in, garbage out. But what is garbage data? We do not have the clear criteria. The second challenge we focus is the fairness stuff. The readmission is a high-stakes scenario. We should take the fairness into consideration. Unfortunately, the most fairness-focused machine learning algorithms have the trade-off between fairness and accuracy. That means they improve the fairness with the cost of the decrease of the predictive accuracy. So our innovations aligns in three aspects to handle the above two challenges. The first one is we shift the focus from the algorithm to data. So the top pipeline is the traditional data-centric learning, the traditional model-centric learning. They collect tons of data and fix the data and trying to propose different models to have the better performance. So you can see in this kind of pipeline, the data and the model, they are disjoint. And what is a data-centric learning is we fix the model, actually we curate the data part. And it's different from the traditional pre-processing, like the normalization of error detection, which is orthogonal to the downstream learning task. For the data-centric learning is actually treat the data and the model as a whole to see what sample is good, what sample is bad. The naive way to know the beneficial or detrimental sample is we put the data into the training and to see the performance have the improvement or not. So unfortunately, this kind of brute force way to check the data valuation is time consuming, especially for large scale data and the model. So the second innovation is we aim to improve the efficiency of the sample influence estimation without retrain the model multiple times. And the third thing is we start from the data perspective to analyze the sample impact in terms of the accuracy and fairness and trying to achieve the Pareto improvement on both predictive accuracy and fairness. So specifically, we have three aims. Even we focus on the data-centric learning, but we should have a model first. So the aim one is we aim to propose a deep learning model for 30 days readmission prediction among older peoples. So we target patients 65 or older who has admitted with COPD, heart failure, and some other common disease. And the clinical factors such as the diagnosed medication labs and the demographic information, race, gender, income, education will be extracted, fit into an advanced transformer architecture to predict the risk of the readmission with 13 days after discharge. And based on this, we propose on aim 2 to explore the data-centric strategy to improve the readmission prediction accuracy and fairness. The first is we will leverage a novel and efficient sample influence function to estimate the impact of the individual data sample on predictive accuracy and fairness based on the model we proposed in M1, so that highly influential samples can be selected for improved accuracy and fairness, respectively. And further, to achieve the optimal trade-off between the model accuracy and fairness, we will conduct a comprehensive analysis of the dual impact of the individual sample on both predictive accuracy and fairness, and develop a theoretical framework to understand their trade-off. So our investigation will focus on determining whether the current model can achieve the Pareto improvement and identify the condition required to establish the Pareto criteria. And for the M3, we integrate M1 and M2, propose a dynamic sample impact analytical training framework that explicitly balances the training efficiency and the performance. So from the efficiency perspective, the dynamic sample inference it remains computational intensive. So we will further propose a layer-based approximation to enable the dynamic sample inference as I mentioned. And from the performance perspective, we will leverage the insights gained from the M2 and design a weight learning strategy to ensure the model performance align with the Pareto criteria, achieving the optimal trade-off between the predictive accuracy and the fairness. So we aim to target the predicted readmission risk, enable healthcare providers to identify at-risk patients early, and implement proactive interventions and deliver personalized care. This may reduce unnecessary readmission, low cost, and improve the public resource usage. Here is the contact information. Thank you for listening.